welcome everyone. We will be getting started in just about 2 minutes. We're going to allow a few more people to join the call, so please hold tight. If you have any questions, please feel free to type them in the chat box. Thank you. All right, welcome everyone to the SAMHSA and Veterans Affairs webinar of Real Talk, Lessons Learned from 2 Governors and Mayors Challenge Suicide Prevention Teams. We are so pleased to have you today for this webinar. We have a number of really great presenters, and I'm Angela Wright. I will be serving as your moderator. I'm the Assistant Director of SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center at Policy Research Associates. And I'll be leading you through this training today. Just a real quick housekeeping note, I would like to ask that all of our participants mute their phones. That will help with the audio throughout this webinar. So, to get us started, I would love to share with you our disclaimer. Next slide. We have a quick disclaimer. These are the views and opinions of the presenters and not the VA or SAMHSA. Next slide. I'd love to share with you who you'll be hearing from today. We have Nicola Winkle. She is the project director from Arizona Coalition for Military Families. She's a nationally recognized public-private partnership, which is a nationally recognized public-private partnership focused on building Arizona's capacity to care for all and support all service members, veterans, and their families and communities. She has briefed at national and international conferences and consults on statewide and national initiatives relating to the military and veteran population. Nicola was part of the team that established the Arizona Coalition for Military Families in 2009 and now manages implementation of key statewide initiatives focused on veteran employment and suicide prevention, including her work with the Governor's Challenge to Prevent Suicide among SMVF. We also have with us today Thomas Winkle. He is the director for the Arizona Coalition for Military Families, and he is also a team co-leader for the Governor's Challenge. Mr. Winkle was a part of the team that designed and implemented the Arizona Coalition for Military Families in 2009 as well, and since that time he's worked extensively at the local, state, and national level, providing training and technical assistance to every state and territory around capacity building and support of SMVF. Mr. Winkle is a combat veteran of the United States Marine Corps and served in the Arizona and Oregon Army National Guard. He is also a licensed professional counselor in the state of Arizona and a national certified counselor. And next up we'll have Brandy Jankaitis. She is the Military and Veteran Affairs Manager with the Virginia Department of Behavioral Health and Developmental Services. She is also a Virginia Governor's Challenge team member as well as a Richmond, Virginia Mayor's Challenge team member. She brings extensive personal and professional experience in programs and services for military and veteran families. In her role, Ms. Jankaitis leads statewide projects to enhance community-based behavioral health and supportive services for military service members, veterans, and their families. Her current projects include coordination of Virginia's Ask the Question campaign to improve identification of in-services to SMVF, military culture training, statewide expansion of SMVF peer services, and suicide prevention efforts. In addition, she is a military spouse, and her family is currently stationed in Virginia. So I'm really pleased that you'll be able to hear from these great presenters today. I'd love to talk next about our learning objectives. We will be discussing the Be Connected initiative in Arizona and describe how this program can serve as an example for other statewide initiatives using a collective impact approach. We'll also demonstrate how interagency partnerships have increased capacity of the service system in Arizona and in Richmond, Virginia. We'll review the crucial elements of implementation, including team formation, sustainability, and specific initiatives. We'll also describe how Governor's and Mayor's Challenge efforts inform statewide action plan development and bring best practices to other areas of a state. So this is a unique platform. We're going to try to make this really interactive for you. The format of this webinar is going to be broken up into 3 segments. Segment 1 will start with a poll question. Now that poll question will pop up on your screen, and we'll read it off to you, and we'll give you about 30 seconds to answer that question, and then we'll display the results. That will be followed by a presentation, and then we'll have time for questions and answers. With the questions and answers, we're going to ask that all of the participants type their questions into the chat box. And then as your moderator, I will select the questions for the presenters to answer during that time frame. On the next segment, we'll have a presentation and then another time for question and answers. And then segment 3 will kick off with another poll question and presentation and questions and answers time frame for that as well. So I'm really excited to present to you Nicola Winkle and Thomas Winkle, our Arizona Coalition for Military Families team, and Governor's Challenge team doing great things there in Arizona. So to kick off their presentation, let's go ahead and start with our first poll question. And I'm just recognizing here today that we have Governor's Challenge teams on the line, we have Mayor's Challenge teams on the line. We may have people who are not involved in either of those challenges and are working within their own communities to better support service members, veterans, and their families with the goal of preventing suicide. So as you read this question, as you think about this question, we will give you some time to think about it. But the question is, if you had unlimited resources at your disposal, does your community have a plan today for how you would solve the issue of veteran suicide? Yes, we have a plan and we would be ready to go. Or the plan is still in development, but we have a good idea of what needs to happen. Or we're still figuring out a plan. So we're going to go ahead and launch the poll. Go ahead and we'll give you a few seconds to answer that. All right. Lots of great answers coming in. All right, we're going to go ahead and close the poll. All right. All right. So it looks like we have a really good percentage of this coming through, and you should be able to see it here in just a second. So it looks like a number of you are feeling that you have a plan in development and that you have a good idea of what needs to happen, but maybe it's not totally figured out. And about the other half of you are thinking, hey, we're still figuring out a plan. We need to figure out what works. So with that, I'd like to pass the ball over to our first presenters, Nicola and Thomas. I'll give the ball over to you. And as you go forward with your presentation, just let us know when you want to go to your next slide, okay?
Thank you, Angela. Well, good morning and good afternoon, everybody. It is always great to connect with our peers and colleagues in states across the country, and we really appreciate you spending this time with us. The reason we wanted to start with that poll question is just to, as we're talking about these efforts, just an encouragement that we always want to plan with the end in mind. You know, obviously we have to be practical about the resources that we have, but we also encourage you not to be limited by the resources and infrastructure you might have right at this moment. Part of building these efforts is casting a vision for what you want to do. And if you go back, you know, to 2009 when we started the coalition and we started down this path, we didn't know what those resources were going to be from the get-go, but we did have a vision for where we wanted to go. And over time, we were able to engage partners who shared that vision and were willing to support implementation of this effort. I also want to just say that we were chatting right before the webinar started about the idea that this is a continuous journey. So even though we've been fortunate to have been at this for quite a while and have a very robust partnership with fantastic stakeholders, it is still a journey for us too. And we're always trying to evolve and continue to strengthen our support for our military and veteran community. So that is that process that we are all in, no matter where we are. So I'm very pleased to be with you today, and you can go ahead and go to the next slide. So just a brief bit about our Arizona Coalition for Military Families. We are a public-private partnership, so we really are the bridge between the military, government, and community entities, and we're established to fulfill that purpose. One way to think of us is we are the neutral territory between those different systems and entities, and we create that neutral space so that partners and stakeholders can come together and focus on specific initiatives. We are this year celebrating 10 years of collective impact, which has been quite the milestone and a very exciting thing for our community, and really just a marker for us for how far we've come, but also how much further that we really want to continue to go. We have a dedicated team that is our coalition team, and what we do is oversee implementation of initiatives. We act as a point of engagement for key stakeholders. Essentially, we are a core team that is there to support our entire community of partners and stakeholders. And the coalition also acts as a coordination point for public and private sector resources so that those resources can be combined toward a common goal. And together, we definitely accomplish more than we could individually for all who serve and their families. Next slide. So we've mentioned that the Arizona Coalition for Military Families is a collective impact initiative, and this model is so important to the work that we do because it is a structured way to achieve social change. And these elements that have been identified for strong collective impact initiatives, and this is a model that is used across many different issue areas and populations. Obviously, in our case, we're looking at our military, veteran, and family population. But these 5 elements, having a common agenda, shared measurement, mutually reinforcing activities, continuous communication, and a strong backbone team. And I think what's important about this model now is that, you know, collective impact is all about not everybody doing the exact same thing, however, having all of those activities kind of pull in a common direction. And so this can certainly be within a community or at a state level, but it also, if you look at all of our different efforts across the country, it's relevant for us because essentially we may all do things slightly different in our states or communities, but we want to be pulling together in a common direction so that overall we can have an impact on our service members, veterans, and their families, and specifically right now, of course, on the suicide rate within that population. Next slide, and I'll turn it over to Thomas.
Thank you, Nicola. Well, just really happy to be here talking with all of you. So I think you can see part of what we originally focused on was this concept of how. How are we going to move the efforts forward, not just on diving into the what, which I think is, a natural response when we see people that are hurting or people that are struggling. Suicide is a real obvious example of that. So, why did we do that? Well, we wanted to have an eye towards creating a very sustainable effort. We wanted to create something that was not a 5-year effort, but knowing what we know about our Vietnam veterans, and sometimes they'll go along for 10, 15, 20 years without very many struggles, but then maybe they have a work transition or they move into retirement. There's a variety of things that can happen over the course of time, and so we wanted to have something that lasted for 15, 20, 35 years as opposed, or further, as opposed to something that was fairly short. We've got this concept of a shared collaboration. It's rarely workable over time without a dedicated backbone team. I think we've probably all noticed or all been a part of commissions or councils or efforts that are not guided by, a principal organization that has structure and funding to it in and of itself, like a collective impact initiative should. And so, our experience had been we had watched, just lots of these different efforts in all sorts of fields, not just with service members, veterans, and their families, fall apart over time. So we wanted to ensure that we had something very consistent so that the work could get done. The need to build relationships and generate buy-in, that is a really important. Nicola referenced the concept of us being neutral. And the best way I can describe this is that there's a lot of competition for metrics of who's serving who and for funding of who's getting what. And those are all really important when there's a backbone entity that is the collective efforts get to be shared amongst all of the different partners. So this is a really powerful tool when you look at if you're trying to engage the VA, Department of Health Services, in our state, Governor's Office for Youth, Faith, and Family. We all share the same metrics because we're all putting effort into the drive of Be Connected. That's good for each one of the organizations, and it's good for the people that are receiving the services. We had a really clear understanding of the very finite number of resources and goodwill. We are, in the very beginning, there was this paper that was written by the chairman of the Joint Chiefs that was called The Sea of Goodwill, and our question mark at the end of that paper was, well, how long is that going to last? We're very fortunate at this day and age that veterans issues are still up front and center, which is wonderful, but there are some occasional slides with resources from certain organizations, and so we wanted to have something that really helped to guide the resources and the goodwill of people towards cohesive efforts that had longevity and sustainability. And then finally, we did not really, probably the most important one, we did not want to promote another effort to service members, veterans, and their families that would be an overpromise, that would underdeliver, and then fade away. I think we've all seen a lot of those as well. And the key point for that is that we believe it is a huge discouragement for the service members, veterans, and their families themselves. we find that is a disincentive to engage with programs and resources, and can actually reduce their sense of hopefulness, which is really rather important when you're looking at the trajectory of their life. So those are just a few of the things that I wanted to throw out about, why we focused on the how as opposed to diving into the what. We're also very fortunate these days because when you're looking at the what we're going to do, there is a lot of assistance for that. Obviously, the TA Center has lots of that around the technical packages for suicide prevention and homelessness and opioid use and all those kind of different things. So now what we view the collective impact efforts that we're in support of, those are the container to hold all those efforts to move forward as your state and your city progresses. Next slide. Thank you. So we came to our very first Policy Academy team after doing a statewide needs assessment where we traveled around the state for 6 months and talked to thousands of service members and veterans and their families of all eras and hundreds of providers about what is it that they are needing and what is it that they're seeing. So we came with a little bit of a plan ahead of time, and what we used our very first Policy Academy for was to ensure that every one of these team members was aware, and then also to codify our particular efforts, the Collective Impact Initiative, and a statewide strategic plan. Very, very helpful for this effort. Next slide. So we participated in a lot of policy academies, and we were very fortunate to be able to do so. We had a variety from 2011 to 2013, which were follow-up events and continued implementation of our action plan. We had been recognized by SAMHSA and others as a best practice model, and the Arizona team started to provide technical assistance to all the other states and territories, both inside and outside of the Technical Assistance Center, which was just really marvelous because we were learning in the same way that others were as well. In 2014, we continued the action plan and implementation for a collective impact and systems change, and really got into some depth with a variety of different things. And what I'll say is that this entire process was always extremely orderly. It never encountered any conflict or challenges whatsoever. Next slide. So not a single challenge ever. There was, I just always felt like the team was just rocking and rolling and doing some amazing things. Next slide. All right. So we went through 2015. We did an implementation academy focused on substance use, and then in 2018, as many of you know, the mayor's challenges. This was an interesting one because we were focusing very intensively on our large city here, Phoenix, and but we already had a plan in place. So part of it was education, part of it was adaptation, and then incorporation into the various efforts that the city had already started, which were at their very, very early stages. So it wasn't that much of an issue to kind of incorporate the effort. But I'll tell you, the final reaction really from the city has been that they appreciate being a part of a larger whole, so that they can take advantage of, the various things that a statewide effort can bring to the table, while at the same time making it, adding some unique features that could only be done with Phoenix, and that they are very proud of. So it's been encouraging across the board. Next slide. So, and then of course, obviously, the Veterans Policy Academy, the Governor's Challenge. We've got an entire focus across the state. We're targeting a variety of different cities. We've got a whole county effort with some of our larger and more rural counties as well. And so we've been progressing very nicely and trying to advance the technical package, if you will, for our state each and every time that we meet in DC or Baltimore. So right now, next slide, I'll pause for some question and answers.
So thank you so much, Thomas and Nicola. That was a really great presentation. If you have any questions, please feel free to type them in the chat box. All right. Okay. All right. Well, at this time, I think we'll go ahead and move on to the next section of our presentation. Please advance to the next slide.
Great, thank you. So now that we've talked a little bit about how we've done things, we'll talk more about what we've done, specifically focused on veteran suicide. And one of the things that we found through the work of our Arizona Violent Death Reporting System is that the risk of suicide is 3 times higher for Arizona veterans and 4 times higher for older Arizona veterans, which is really important for our state because over half of our veterans are older and aging veterans, so that number becomes even more important. And then as we've developed our initiative and efforts, we've realized that in some ways we have had to look at how we redefine what suicide prevention means. We think all too often when people hear veteran suicide or suicide prevention, your mind kind of tends to immediately go toward that moment of crisis. And obviously attending to those moments is very important, and we have our different systems and programs and resources that are designed to intervene at that time. But we take a much broader look at what suicide prevention means, and that's what we're going to talk more about now. Next slide. So some of you may have seen these numbers before. The CDC has a technical package on preventing suicide, and what they outline there is these numbers, which is that it shows that suicide is really the tip of the iceberg when you look at the impact on our community. So for every 1 known suicide, there are 9 people treated in hospital emergency rooms for self-harm injuries. 27 people make a suicide attempt, and 227 people report thoughts of suicide. Next slide. So in Arizona, what that translates to is over an 18-month period, there were 393 known suicides. That translates to 3,537 veterans treated in hospital emergency rooms, 10,611 veterans making a suicide attempt, and 89,211 veterans that had thoughts of suicide. Next slide. So that's all about intervention at that point of crisis. These are individuals who are in the intense orange and red stress zones. We use the stress continuum that was first created for the Marine Corps and Navy under their combat and operational stress first aid model. So what we want to do is our goal essentially is earlier intervention to positively impact social determinants of health. So if you go to the next slide, if we look at our known suicides, we go down the pyramid and we're into the orange zone, which is those who are having thoughts of suicide. What we want to do is look at what are our wider windows of opportunity for intervention. And those wider opportunities are in people who are maybe just edging into orange and those who are in the yellow and green zones. And those icons along the bottom are really about how does impacting those social determinants of health pre-crisis have an impact then on what happens as you go up the pyramid. So that's really the premise of our program, and we'll talk a little bit more about how that came about, and I'll hand it over to Thomas.
Thanks, Nicola. All right, next slide. So I'll talk about some of the program history in just a second, but what I want to show here is what we built. So we knew what the issue was. We knew about the 393 known suicides. We knew about social determinants of health, and we also knew the partners really well within the state. And we knew the ones that had a very strong focus towards service members, veterans, and their families, and how they would respond to trying to have a kind of a grand collaboration, if you will, called Be Connected. So we took ourselves, the Governor's Office for Youth, Faith, and Family, Arizona Department of Veteran Services, National Guard, VA, our state Medicaid system, Tri-West Healthcare Alliance, which is headquartered here in the state and is dealing with our choice efforts within the state, and then a couple of Crisis Response Network and La Frontera, which are nonprofits within Arizona. The first Crisis Response Network being our statewide crisis response system, and then the second one being a mostly statewide training, education, counseling, peer support services type of an organization, and put those together and created a program called Be Connected. Next slide. So Be Connected as a program was its beginnings was in a program called Be Resilient. And that was a Guard-specific program. In 2010, the Arizona National Guard had its highest rate of suicide ever. It had been growing year by year, and it had been actually the highest rate ever for the past 2009 and 2008. And they didn't quite know what to do, but they wanted to do something. So we were able to completely restructure their programming, the training that everyone received. We were able to bring in a variety of different organizations in this exact same collective impact model that we're talking about now. And we were able to drop the deaths by suicide from the highest rate ever to 0 for over 36 months while the program was ongoing. So we had some really good success with that, and we learned a variety of different things. And then along 2016 came this thing called the Clay Hunt Suicide Prevention for American Veterans Act. And so Senator McCain's office helped to bring that into the state for our Phoenix VA, and there was one little line in that act that gave us a huge, wide open door. And that one little line was that the VA would collaborate with the community in order to help facilitate its suicide prevention programs. Okay, boy, this was great. So through a series of long discussions of a variety of various entities, trying to, work a variety of agendas, we were able to then come up with, in 2017, the Be Connected program, which was really carved out of this little opening that the Clay Hunt Initiative, or Act, provided for us. It was so different, this collaboration was so different and so unique that for a period of time, the VA did not even consider what we did here in Arizona as a part of the Clay Hunt pilot programs. They have since, absolutely accepted it and said, okay, awesome, great, and love the idea. But it was a very different model that we just happened to be really well prepared for to be able to jump into that. Next slide. So, really simply, Arizona's approach is where? We're statewide, so we go everywhere. We are interested in all service members, veterans, family members, providers, and helpers. So it's a resource to everyone. This is regardless of whether they are the 30% of our state's population that are engaged with VA services or the 70% who are not. We're trying to make sure that everyone's taken care of. Does not take into account whether or not a person was dishonorably discharged or medically, any of those things. If you served, if you're a family member of any ilk, a provider or helper of folks that serve, we're open to you. And then what? It's an upstream, earlier, more effective intervention to prevent crisis. We've got all our crisis systems intact. They're communicating with each other at the point of intervention. We've got a post-vention efforts that we're, have developed and are rolling out as well. But the primary focus is all of those folks that, that we pointed out in the pyramid earlier that are well before the red and orange stages of their stress. So, and then the final thing is how. We do a ton of outreach. We have engagement, resource connection, coordination of care. We have both community peer support navigators that are Be-Connected navigators, and we also have VA staff, FTEs, full-time employees, that are Be-Connected staff for the VA. So it's, again, a really unique kind of crossover, all trying to orient towards the same effort. Our outreach efforts are wildly extensive. We've trained over 50,000 individuals across the state in military culture. We have over 4,000 navigators, which is a half-day-long training that we provide to them. We've got people in all sectors of and walks of life, from HR employees to first responders to faith-based organizations. You name it, we've got it, which creates a really tight web so that people do not fall through that. And now I'd like to turn it over to Nicola.
Thank you. Next slide. So Be-Connected as a program has 3 components. The first is CALL, and that is a support line that is available, as Thomas mentioned, to everyone in our community. And we want to be here to support sort of our end users, our service members, veterans and their families, but also those who are in helping roles and supporting roles, whether they are family members, whether they are providers or community helpers. So we launched just almost exactly 2 years ago. In that first 2 weeks of operation, the support line fielded 5 calls. In year 1, it was almost 1,500 calls, and in year 2, you can see that it was almost 8,000 calls. So over a 400% increase year over year. So the first test is always utilization, and we definitely have seen utilization of this. This line is staffed and equipped to handle crisis 24/7. During business hours, staffed by our dedicated Be-Connected team. But truly our goal is to be working with people in pre-crisis. And that is what we have seen. When you look at the acuity level of our calls, a vast majority are individuals who definitely have pressing issues and needs and concerns, but they are not in a crisis situation yet. And so we feel very encouraged with how the messaging has gone out with that, and that people understand perhaps the distinction from some of the other crisis line resources that are so important to our community. And I will say that, as you know, just as a note, as we've stood this program up, partnering with a very experienced organization who is very knowledgeable about administering phone lines is really important, because you want to have that capacity and expertise around fielding something like this to ensure quality service delivery, as well as efficient operation and really strong and robust data collection. The second part of Be-Connected is Match. So this is personalized resource matching, and navigation. And we do this both online through our resource matching platform as well as through in-person navigators. So our team of navigators, that part of the program has only been in operation for basically, since the beginning of 2018, so 1.25 years, and they had over 7,000 encounters. And we are currently expanding to a team of 8 navigators statewide. We're also developing a closed-loop referral system to better track the impact on social determinants of health and be able to do that organically through our platform. And then the third component is Learn, which Thomas referenced a little bit, and we have both online and in-person training. We do partner with PsychArmor for online modules, both their provided ones as well as ones we develop. And then we have a variety of different trainings, and our viewpoint on things is one of the things we really try to do and have always done since the beginning is really try to blur the lines between the people who help and the people who need help. We learned this back in our work with the National Guard that, one day you can be a helper, and that same day or the next day you can be someone who needs help. And we need everybody. And so we can't be in a situation where we're cordoning off people and being like, you're a helper and you're a person who needs help. Those things can transition back and forth. And so to that end, we offer this training to absolutely anyone and everyone in our community who wants to participate. We do host an annual statewide symposium. This past week we just hosted our 10th annual conference, and we had over 650 people come in from around the state, and it's an opportunity for professional development, networking, and ensuring that we're always advancing the knowledge of our community as much as we can. On the next slide, you'll see some photos from some of our military culture training. Thomas mentioned that we have trained over 50,000 people over the past 10 years. Some of those have been full-blown military immersion trainings on the military installations. You can see the teams here. Those are wonderful events. They are great opportunities for civilians to really better understand the military perspective, and we always have fantastic feedback. Those events obviously require great cooperation and support and partnership from the military entities, and they have been great to work with. But we also do that same training in sort of smaller settings at our symposium, at in-service trainings, throughout all sorts of different kinds of venues. And the important thing is to give people who may not have that military background a connection to the military perspective and experience. Next slide. And then as Thomas referenced, we do have a resource navigator training that we developed here in Arizona. It's 3 to 4 hours long and essentially focuses on teaching people how to be an open door. How can you be a person who can connect someone into the resource system? Whether, some people go through this training, this is their bread and butter, they do it every day, and others are kind of just regular individuals who are going about their work but want to be equipped. So, librarians and first responders and mental health providers and people who work in different employers, all sorts of different individuals. And we did just in the past several months train our 4,000th navigator. Next slide. So essentially, we have served, if you look at it, 16,700 service members, veterans, family members, and helpers directly in 2 years' time. And that's, something that we're very honored to have done and very excited to have had that much reach for the program and that much growth. But in reality, for us, and you look at our state population, it's probably about 1% of our target population that we have served. So when you look at that and you say, great, I'm glad we've made so much progress, oh my goodness, how are we going to reach all those who need our help? And so that's the question. How do we reach and serve all who need to be connected? Next slide. So our answer to this is that we are building a program that can be both responsive and proactive. So in the first 2 years of operation, Be Connected has largely been a responsive program. So, someone needs help, they call the support line, they reach out to a navigator, the team responds, and they provide that help. And we will continue for sure to focus on being responsive when people reach out for help. But in order to reach, everyone that we need to have an impact on our community, we realize we also need to have a proactive approach. And essentially, that is where we use data and community input to identify vulnerable populations and then proactively engage those that are at higher risk. So some examples of groups that we have on the radar to work with are justice-involved and incarcerated veterans, rural and tribal veterans, veterans who have or are at risk of opioid use disorder, transitioning service members. We've done a small pilot program working with veterans who were housing insecure and focusing in on proactively engaging those individuals and saw great results from that very small pilot program. So that's essentially our strategy for how we will ensure that we have the impact on the population that we need to. So I believe we're going to pause and to see if there's any questions.
So we can go ahead and take a few questions now, Nicola, before you pick up the next part of your presentation. We have a number of great ones that have come in, and then we'll have time for a few more after the end of this particular part of your presentation. So a couple of questions that came in were, what would you like to see from a nonprofit that's offering assistance?
So one of the things that we did very early on, this is going back, 8 or 9 years, is we realized it was important to provide sort of a framework for organizations to engage. The vast majority of organizations and people are very well-intentioned. They want to be helpful. However, we saw that there could be significant gaps in internal capacity, knowledge, procedure, depending on how much experience the organization had. So we definitely like to see organizations engage, and that's part of the role of the coalition, is to provide that training and technical assistance so that those organizations can equip themselves with the right processes and to equip their staff, employees, volunteers with the knowledge they need to be effective in this space. So that's a large role we play in supporting our partners in that way, and we definitely are very encouraging and provide that whatever they need to get up to speed, essentially.
And I'll just throw in that I think it's really critically important. The military analogy is to look to your left and look to your right when you're standing in formation. That's a thing that silly Marines do to make sure that we're lined up. And the analogy is essentially that we encourage nonprofit organizations and other interested parties to see what else is out there prior to starting a program and dedicating time, energy, effort, resources to it. There's lots of different examples of people's just amazing hearts and goodwill that unfortunately, because maybe the landscape is inundated with that effort already, or it's not a relevant need for that particular area or population, that goodwill basically is not fully utilized. We have one example here within Arizona where I think at one point we had 12 to 13, 14, something around there, equine therapy programs that had just all of a sudden popped up, and the ability for the community to respond to that and then, make referrals, and the ability for the veterans to get interested in that was not very high. So I think now we're down to 3 or 4, which is probably the appropriate number. But it pains me to think about the time, effort, and energy that was not utilized well in those situations. So take a look to your left and right and see what else is going on in the community, and talk to lots of people before you act.
Thanks, Thomas and Nicola. I have another really great question. Is the Be Connected system one that you built or bought? Is it available for other states? We use Unite Us for handling referrals.
So yeah, we actually built our own system and kind of established it specifically for a need that we saw around asset mapping, and then are now in the process, I'll talk a little bit about this in a few minutes, of building out the capabilities to essentially support the evaluation and impact gathering that we need for the program. So yeah, we had gone the custom route, and that was underway sort of several years ago when I talked about sort of envisioning where you want to get to, and before you maybe know exactly how you'll do it or what the resources you'll use to get there. That was a situation that we had to. We really understood what we needed, and it took time to develop and build, and then now we have that and are continuing to evolve it.
Great. Thanks, Nicola. Another question that was posed was, Arizona has a large Native American population. How did you incorporate cultural considerations into your planning and work implementation?
That's a good question. Yes, we have an extensive community of tribal nations, and we have definitely understand the the higher service rate in those communities, and so therefore a very significant impact of military service on those communities. We were really have been honored to work with our governor's tribal policy advisor for tribal needs, and she was part of our policy academy team in February. We're also, there's an intersection, we do have some tribal nations that are in urban areas, but there is also an intersection between serving our American Indian veterans and, serving rural areas. So we, our model is very much about community engagement and partnership. And so we look at it as how can what we've built on a statewide level be partnered with communities to meet their needs. So when I talked about, the moving more towards being proactive from being more purely responsive, that is definitely an area that is a focus and ensuring that we can meet those needs by partnering with communities. So that's very much sort of our approach to that.
Great. Thanks, Nicola. So I'm going to pose one more question, and then we'll go ahead and finish up your presentation and then have a little bit of time for additional questions before we move on to our next presenter. So the last question that I'm going to pose in this time frame is about your resource navigation training. There was a couple that came in, so I'm going to clump them together a little bit. They are asking, are your navigators and those who work within the program volunteers? And are you able to share your curriculum for resource navigator training?
Very good questions. Yes, thank you for asking that so I can make a distinction. So we have different kinds of navigators. We have our dedicated Be Connected navigators, meaning that they work full-time, they are employees of the program, and they work full-time providing navigation to our community. And those are the team that we're expanding to a team of 8 navigators statewide. and they are available to serve our community. Our Resource Navigator training program, which is a 3-hour training that we provide, that is for community members. So these, they are people who could potentially work in some full-time capacity in our veteran community, but by and large, most of those individuals have other roles. And so they are not volunteers in the sense that, they're sort of part of a formal volunteer program with us, but they are in the sense that by going through the training, we're essentially, our goal is to create thousands of open doors around our state, embedded in communities and organizations throughout our community. So the focus is on having both those core navigators that are dedicated to the program, as well as individuals who can be hopefully in close proximity to service members, veterans, and families who need that connection, and maybe hopefully are even a trusted kind of person in their life already. As far as our curriculum, we have provided a lot of technical assistance and consulting with other states around this type of effort. We don't yet have a train-the-trainer model, although that is something we are sort of moving towards. So it may be a possibility in the future that we would be able to share that and perhaps train other states to use it as well. But so far it has been used primarily in-house, and we've provided kind of training and technical assistance around more the concept of training community members to perform this function. So I'm going to dive back in and talk about evaluation, obviously so important to all of us for the work that we do. And I wanted to talk a little bit about our evaluation evolution. So, you start a program and, in a way, the very first test is utilization. Will people use Be Connected? Will they call this phone number? Will they reach out to these navigators? And, for all those, almost, it'll be 10,000 calls very shortly here that we've fielded. And I don't take any one of those for granted, because in such a crowded landscape as we live now in terms of resources, it is not easy to get people to use something. And that's not even because they're reluctant necessarily, although that can be part of it. I mean, part of it is just there's so many things, and you have to communicate, what is this, and who's it for, and why might you use it? And you don't have a lot of time or bandwidth in which to do that. And so the fact that we've had all these people reach out, know what it's for, believe in it enough and trust it enough to pick up the phone and call or to reach out to those navigators, I just never take that for granted. So the first test is, we evaluate, is this used? What do those trends look like? The phase we're really in now is focusing on evaluation of service delivery. So as we've built the program, we go from one person to, continuing to reach many more, and we have to have quality consistency statewide, and then we're looking at how do we measure impact. What is the impact of this program? So all this happens in context, which is that we're one of 7 states in the Governor's Challenge. We're one of 5 programs working with the CDC and the CDC Foundation on veteran suicide prevention in community-based organizations, which is a great project, working with our county Department of Public Health here in the Phoenix area on a 5-year county health improvement plan, and one of 14 communities in a national data project on veteran suicide. Next slide, and I'll turn it over to Thomas.
Thank you. All right. So I really firmly believe this next statement. It is a great time to be doing the work that all of us on this call and so many others are doing. There are just some really new things that are happening, not just with the executive order, but with the VA, the SAMHSA VA policy academies have incorporated a variety of new techniques. I love the technical packages because there's a clarity to them, and there are upstream models It is really an encouraging time. I think back 10 years ago when we first really started and codified everything, as I discussed previously, and it was the Wild West. It was just, there was so much going on, and there were, dozens of organizations, purporting a specific philosophy or saying, homelessness is the most important thing, or suicide prevention is the most important thing, or, people's finances, or we got to support the troops through, assisting their families. And the truth is, the reality is, all of that is critically important. It's all really important. So now what I'm starting to see, if I can just kind of go on this little bit of historical, remembrances, is we're starting to see more and more clarity, more and more refinement of what our purpose is. And that is part of the reason why we chose to be involved with the executive order on veteran suicide. We were able to contribute to it. Some of the elements are fashioned off of successes that we've had within our state. There are other state successes that have been incorporated that are, just wonderful best practices as well. And I would encourage each and everybody on this call to take a really good look at it. Watch the video. It's about 25 minutes, maybe max. Listen to the gentleman that speaks before me, Frank Larkin. We had him come out to our symposium. Remarkable individual, lost his son to suicide. But he was a 9/11 survivor and helper. He was, he's a SEAL person himself. Variety of different Secret Service, and he just has some really remarkable things to say during the executive order, which I think are powerful. I loved hearing Secretary Wilkie's comments. The event was important, but read the document as well. Read the executive order. I strongly encourage, because what it's doing is it's attempting to orient you to what we are hoping to be able to do across the country. Next slide. Thank you. So this is a little bit of a breakdown of it. Some of the important elements to it is that what it does is it orders essentially alignment of federal agency efforts. There are a myriad of federal efforts, all well-intentioned, all potentially positive, that oftentimes interfere with each other. So Department of Labor had a really good employment program going, and then the VA was ordered to create a workforce program. So they kind of conflicted with each other for a number of years. That creates confusion amongst everybody, not just providers, but most importantly the service members, veterans, and their families. So that's one of the goals of the executive orders, to align federal agency efforts towards a common goal, just like what we're talking about with a collective impact initiative. Funny how that works, right? The second thing that we have up here on this slide is the public and private sector working together. The quickest example that I can provide is what we've been able to do with the Be Connected program, which was just it's like, it's just the shortest little sentence as a part of that Clay Hunt Suicide Prevention Act, and yet we were able to really forge a really strong and very positive collaborative element between the VAs, between the community and private sector partners. Really just a wonderful example. And what we're hoping is that this will help to facilitate that all across the country in each and every state, to give a collaborative model for the VAs to be able to follow through with, so that they can work with the community in a much easier fashion. Because there are folks all throughout the VA that want nothing more than that. They want to work with the communities, but there's not always the best pathways to do that. The third one there is equipping states and communities. What's really important about this is that there's funding attached to it, both for the collective impact effort, the backbone effort, and programmatically. So they're working with Congress, working with a variety of different agencies to help make that happen. That's part of what the task force's mission is to be able to make it so that there's support for what we all want to do, but sometimes just don't have the capacity to be able to do. And then finally, as a coordinated national research strategy, the concept there being is that there really are a lot of very interesting and promising studies involving the brain and traumatic brain injury, as well as post-traumatic stress, as well as homeless efforts and how to work with those. But there are, and many other things, but those research efforts are siloed, and they are not communicated to make them become operationalized in a speedy fashion. So they sit in papers and they sit in research projects and aren't necessarily pushed out to the community where we all can take good advantage of them. So that's really a good, clear picture. There's two sources that you can find the information on the Prevents initiative, and one is if you go straight to the White House website, whitehouse.gov, I believe, and then the second one is on YouTube. You can actually watch the video. But if you look up Prevents Initiative or Executive Order on Veteran Suicide Prevention, you'll find some of the information. I'm sure we can pass that out as well. And I will turn it back over for a final time to Nicola.
Just going to wrap things up. Just a few notes about what's next. Actually, we're just in the midst of developing our partner process for communities and organizations to engage with Be Connected. As I mentioned, we've got some website developments in terms of Navigator user communication, closed-loop referral system, and then using that platform to measure impact on social determinants of health. And then we will be doing a statewide roadshow this coming year, which we're really excited about in terms of bringing Be Connected around the state. And we'll also be administering our 2019 Arizona Veteran Survey, which will be the second time that survey has been deployed. Next slide. So we just wanted to highlight some key areas of alignment that are really critical to these types of efforts. You've got to have alignment of mission and vision. You have to have your leadership and stakeholders engaged and pointed in the same direction. Aligning resources can really make your resources stretch further and your impact be greater. And then just having that alignment of effort toward a common goal. All these elements are so important and critical when you're trying to work towards that collective impact. Next slide. And just a few takeaways. So take time and use some of your resources at least to make sure you build the infrastructure. That includes your backbone team, but it might include other elements as well, so that as you're doing all these things, there's something strong to kind of uphold them and carry them forward. Make sure you staff your efforts with the right people. You definitely need people who have passion, but you also want people who have the experience and skills with implementation. These are, there's very specific skill sets that are needed for these types of initiatives, and so you just want to make sure that you have those people at the table who can advise, support, and implement. Use all available opportunities to advance your effort. You saw some of the things that we're involved in with the different national data and evaluation projects. Maximizing if you're part of the SAMHSA team process, maximizing every opportunity that you have to get the most out of those things. And then draw upon effective practices from other issue areas. As these efforts, collective impact efforts, are evolving, we're even looking at things like global health and how they've managed to focus in on the AIDS crisis in Africa, for example. The same vulnerabilities that they see in those areas, there are parallels in looking at vulnerabilities in our military, veteran, and family populations. And some of those lessons learned can be very informative to our work. So we like to cross-pollinate across different issue areas. Next slide. We thank you for taking the time to share with us today and to learn a little bit more about what we're doing. And here's our contact information, and you can certainly feel free to reach out to us at any time. Thank you.
All right, thank you so much, Nicola and Thomas, for a really great presentation. We now have time for additional questions and answers, about 10 minutes. So I'll throw out there a few questions that came in. We had some really good ones. First up, how are you measuring impact of individual interventions or the impact of the bundled interventions?
So, as I mentioned, that evolution that's taking place where first, utilization, second, how are those services being delivered? What is the sort of customer experience, if you will? And what we're in the process of really building out is the capability to assess impact on those social determinants of health. So certainly anecdotally, we understand that the work and the services and support that's being provided by our fantastic team every day is making an impact on those, but we're really in the process of building out the capability both from a technology standpoint as well as just sort of a process standpoint to actually, hopefully in real time, measure the impact on those social determinants, both immediately as well as on an ongoing basis. So I'll just say it's a work in progress, but we're looking at how at those points of intervention do you capture where that person's at, what you did with them, and then what was the outcome or result of that. Angela, was there another question?
Sorry. I'm sorry, everyone. I was on mute, and I was asking a question.
Okay.
I greatly apologize for that. Okay, so the question that I wanted to pose next was about your program components of Be Connected. So you had a really great slide that talked about call, match, and learn. And there's a few questions that stemmed from that slide. And so the first one is, when you say 7,000 plus encounters in 1.25 years, is an encounter a phone call or a face-to-face encounter, or both?
It could be a range of encounters. So we have, individuals that are served on more of an ongoing basis. Generally, our navigation services are brief in that they're not meant to be like ongoing case management necessarily, but really to help guide someone toward the right resources and make sure that they're connected in. So that includes individuals who are sort of in more that level of engagement. But our navigators are also out and about on a regular basis, and so they will also do more brief encounters, say at outreach events or different things like that. So it may be more on the fly, providing connection to a resource or some other kind of guidance or support, all the way up to more intensive services for maybe people who have multiple needs. So we have a lot of flexibility in how we administer this program. We try to be as sort of non-rigid as possible, and so we'll serve people by phone or in person or at community-based events.
Great. So the next question along the lines of your program components is a technical question about what platform are you using for your online training, your Be Connected e-course?
Oh, good question. So as I mentioned, we partner with PsychArmor for their broad library of content. And for those of you who don't know, PsychArmor is an online training platform specifically focused on serving our military, veteran, and family population, and they have dozens and dozens of courses on all sorts of different topics, and those are available to anyone in the community. But they also have a program where you can partner with them to develop your own content. And so that's what we did, and we'll be doing more of actually just in this coming couple of months. So we developed a Be Connected e-course, which is essentially an introduction to the program and, provides some, similar information that I've talked about here. And so we worked with them to script that out and film it and put it together. And it's an interactive online learning platform. But what's great about it is that people can go through that e-course on the PsychArmor platform, but they also can export it into the universal learning management system platform. And then, so let's say if you have state agencies or other larger, organizations that have an online learning management system, they could just import that course and drop it right into their system and assign it to everybody who needs to take it. So it's a very flexible approach to developing content that can be used in multiple ways.
Thanks, Nicola. The next question is, who is the staffing for the call center, and how is it paid for? And what is the staffing for the call center, and how is it paid for?
Okay, good question. Yes, so within our partner Crisis Response Network that operates all a crisis line, but also different other telephonic support lines. So there's a dedicated team within Crisis Response Network that answers the Be Connected support line. And so, these are, individuals who are trained in resource navigation and providing that support. So that's how it's staffed. And as far as how it's funded, from the beginning, we've really had a combination of public and private sector partners come together for this effort. Along the way, our state agencies really have supported strongly the development of our sort of statewide collective impact initiative, as well as all of these different elements that go into delivering these services. And then we've been fortunate to partner with the Phoenix VA here to expand the availability of those services to our veterans and families across the state. So all of that, is there. You can look at it like there's all these different components of the program, and then there's different partners that are executing different segments of that program.
I'll just say in the very beginning of it, keep in mind that we had one call center staff, and so that was funded through a combination of one of our our State Department of Veteran Services, and then we were able to round up some funding as well for that. And so then we were able to kind of show what the effect was, start gathering data and things like that. So it's never a bad thing to start off with, start out small and start to grow it over the course of time. And I think with each expansion, it's been fairly easy to show what we've done and then say this is what we would like to do, and then go out from there and work with our funders to be able to make that vision happen.
And just a plug to what Thomas was talking about earlier in terms of sort of how we use our resources and how you stand up new efforts. It is far more cost-effective for us to partner with an organization like Crisis Response Network that not only has the expertise and experience and infrastructure, but it is very cost-effective for them to add a support line to their existing operation. We're not starting a brand new organization or agency and trying to, both operate that as well as from scratch build everything that you need in order to deliver a very robust support line effort. So I just, we always encourage to look at what are the opportunities to build upon your community's existing capacity, because you can do it much more efficiently than if you're building things from scratch.
Thanks. So we have time for about 2 more questions. I'm going to pose this first one, and it kind of builds off of what you were saying about expanding your program. We have this same sort of thing in Lubbock, Texas. How did you expand to the rest of the state? So how did you engage the whole state in your Be Connected program?
I'd say we kind of did it backwards from what you're describing. So we established the coalition 10 years ago as a statewide public-private partnership. So we started at that level, just understanding that our ultimate vision, it wasn't because we had the capacity right out of the gate to serve the entire state. It was that we had a vision for what we wanted to build for our state. And so, there's different ways that this can happen. One is what you're describing, which is sort of more of a community-based effort or sort of a locality-based effort that then can expand to become a larger effort. And a different way to do it is to do what we did, which is to start at the state level and say we're going to focus on building our infrastructure, our partnership, our engagement, our plan at that level, and then look at how do we partner with local communities. Make no mistake about it, though. Like from day one, we have said this thousands of times, which is we are building things at the state level, but for sure, the magic happens at the local level. Needs get met at the local level. So we don't look at this and say, well, we can just build this statewide initiative and then we're good to go. It has always been the vision that we want to build the infrastructure at the state level from partly an efficiency standpoint, partly a consistency standpoint for everyone, but understanding like we've got to partner and continue to layer down into communities to have over time to have the impact that we want to have. So if you're going the other direction, I would say probably one way to approach that is to look at what are all the efforts around your state that are of similar goals and vision, and can you align those things even if they may have started differently and disparately? Like, can you align yourselves into a statewide effort that connects you all together? Because if you're doing this kind of work, in the end, it's no true mystery. We're helping people to connect to resources. So usually there ends up being a lot of alignment between these types of efforts, even if they are separate. So that's one way to approach it, is to look at, are there peers, colleagues that you have, organizations, efforts that you can then collect up together into a statewide collective impact initiative.
The other thing I'll say is that, I think there's a sense of, Arizona, we have a huge area of land, most of our state really, that is highly rural. But we're able to manage and work with the entire state with one organization, the Arizona Coalition for Military Families. And then what we did is we utilized the CVEBs, the Community Veteran Engagement Boards, which I hope most of you are familiar with, for the North, Central, and South as ways of regionalizing what we're doing. But clearly that will not work with a state the size of Texas or California. And so I think with those states, just in my discussions with some of the state and city teams from Texas and California, it seems like maybe there's a larger statewide collective impact initiative, but then you've got smaller regionalized, efforts that are in support of the whole. There's a lot of ways to do that, but there's a lot of strategy around that too that I think, we'd be happy to talk about in the future.
All right. Thank you so much, Nicola and Thomas. I'm really really great information to share. We're going to move forward with our next presenter, Brandy Jankaitis. She's with the Richmond Mayor's Challenge team and the Virginia Governor's Challenge team, and she has a lot of great insight from the work that they're doing there in Virginia as well. And but first up, I think we'll go ahead and launch our next poll. All right, so you can see up on your screen, go ahead and launch it. It's a question: do you have a sense of how many service members, veterans, and their families are living in your community? And the answers are yes, I have a good sense about my SMVF population. Next is I have a good idea, but I am unsure of the SMVF population. And the last is no, I do not know how many SMVF live in my community. So I'll give you a few seconds there to answer the poll, and we'll get a quick gauge of your sense of population in your communities. All right. So it's looking like it's a pretty good mix of answers. So a number of you have a really good sense. Some of you you have a good idea, but you're unsure. So I'm looking at a good mix of that. So there's a number of things that Brandy will talk about that can help you understand your population. And I will go ahead and pass the ball over to you, Brandy.
Thank you, Angela. I am honored to be on the webinar with Arizona, and just want to say thanks to Nicola and Thomas for the comprehensive presentation on the Be Connected Arizona model. Lots of exciting ideas. I was furiously writing notes, and I had team members texting and emailing about some of the ideas you talked about. So thank you for that great presentation. Also, thank you to Veterans Health Administration and SAMHSA for hosting these TA webinars, and for the Mayor's and Governor's Challenge process. And to all of my Virginia team members on the webinar, thank you for joining and for supporting our efforts in a whirlwind journey a year ago for Richmond City, and really since December for the Governor's Challenge level. And everyone who's still hanging in on this webinar, and for doing the life-saving work you're doing. So let's jump in and talk a little bit about exactly what the poll question was about, is what does the veteran population look like in Virginia? And it's really broader as service members, veterans, and families. And this will help you maybe draw some context to your team and how we've applied the strategies as far as our population ratio. So in Virginia, we're extremely military and veteran dense at approximately 725,000, or 1 in 10 of our citizens is a veteran, 1 in 5 in our greater Hampton Roads or coastal area. We have a large percentage of women veterans and veterans under the age of 28. We're 4th in the nation for active duty presence, and we have just under 9,000 National Guard service members. And you can imagine how much bigger this network gets when you include family members, dependents, caregivers, and loved ones. So it's an important part of the Commonwealth fabric. Next slide. So I mentioned in the introduction that Richmond, our capital city here in Virginia, has been in a Mayor's Challenge journey under leadership from Mayor LeVar Stoney and from our public mental health center in the city, Richmond Behavioral Health Authority, for a year now. So we are early days, like some of you, on the webinar today. So we draw a lot of mentorship from states like Arizona that have comprehensive efforts. And it's a message of hope, really, that our efforts that all of us are building now can really be sustained with the right resource support. It's about a year-long journey for the Mayor's Challenge, and it really did grow over time over that first year with a city focus, with our human services agencies within the city, local nonprofits, but we had key membership that had a state and regional lens from the very beginning. For instance, my position as Military and Veterans Affairs Manager with the State Department of Behavioral Health, I provide key logistic support to this city-level team. So from the very beginning, we were thinking the best practices that we can pull out of this city process. How do we link arms with state agencies and other statewide partners and our other federal partners like VA medical centers, vet centers, and community-based outpatient clinics? How do we take this statewide? So that was a focus from the very beginning. Next slide. This is just a picture to show you some bright shining faces from a meeting of the Mayor's Challenge team here. In the center with the peach tie is Mayor LeVar Stoney. On the right in the tan is Dr. Lindstrom, who leads the Richmond Behavioral Health Authority. And on the left is the Secretary of Veterans and Defense Affairs, Carlos Hopkins. And there's so many champions spread within that, including our Commissioner of Department of Veterans Services. And it just really reemphasizes that we had that local, regional, and state level buy-in from the very beginning for the Mayor's Challenge team. Next slide. And the TA process, like all of you are experiencing, gave us framework that really bridged mainstream suicide prevention efforts, which are our state suicide prevention plan and the communities and their local planning. They're used to the Center for Disease Control Comprehensive Suicide Prevention Strategies and that technical package on the right. And then now we have strategies from Veterans Health Administration that we can build in the SMVF focus. So it really was about bridging mainstream or civilian focused or all Virginian focused suicide prevention efforts and military and veteran specific efforts. And these frameworks gave us the tools to do that. Next slide. So now I went from the broad framework. Now I'm going to dive into a tool that we utilize with the TA Center called Crisis Intercept Mapping. And many of you have probably heard about this in your TA journey, but this tool was deployed for the Richmond City team about 4 months into our Mayor's Challenge journey, and it really took us from high-level framework and strategies down into the weeds where we needed to be and gave us really actionable next steps. But so I'll go into those specific things. But first, the map helps you look at your community across the spectrum from first contact, acute care, emergency response, into care transitions and ongoing recovery, and who your key partners are at all of those intercepts. And for us, it really bridged military and veteran specific resources with mainstream. It helped us identify any service gaps and work to close those. And it thread in the Crisis Now best practices, which is really important for our entire state focus. And we were able to drill down in our Mayor's Challenge action plan through the Crisis Intercept Map journey, and it created an action plan from the mapping that was thread into the overarching strategic action plan for the team. Next slide. This is just a picture of the map. I won't spend a lot of time here, but it's just a reassurance that the TA tool can help structure your work at those key intercept points that I referenced. Next slide. So now let's drill down. Excuse me. What were action items within the Crisis Intercept Map for the Richmond team that you may consider pulling into your process, whether it's part of mapping or not? Just elements as you consider next steps for your team's plan. Next slide. So there has to be, I talk a lot about bridging mainstream or civilian and service member, veteran, and family focused systems. So as part of the Crisis Intercept map, we looked at what is our state system dealing with for all Virginians who are served in the public crisis services system. And the take home from this is an understanding of what resources look like on an outpatient, acute, inpatient, and then hospital spectrum. What does the system look like? And then the strains on the system, such as intense census pressures for inpatient resources, staff that are working under strain in our state hospital system. Because if we set up SMVF-focused goals and objectives that don't deal with the underlying system pressures, then they're not going to be realistic and sustainable. Next slide. We took the same lens, of course, to the city level. So you have the state public crisis services and then local crisis services. So the lead agency for the Mayor's Challenge Journey is the Richmond Behavioral Health Authority, or that public mental health center. And so we really took a deep dive into what their crisis services looked like at the city level. And taking that lens to the state, we have 39 other community services boards that would have similar type services to RBHA around the state. So it again helped us look at what we accomplished with Richmond Behavioral Health Authority and how to take that statewide now as part of the Governor's Challenge. Next slide. Speaking of data and knowing the SMVF population in your community, one of the focuses for us, there's lots of data out there, but two key resources that we utilized was Veterans Health Administration decedent data, as well as our Virginia Violent Death Reporting System. And you heard the Arizona team talking about their violent death reporting system as well. So it's pulling in death data to look at, among those that we lose to suicide, what were the risk groups, what were the risk factors we needed to hone in on. And so for us, we're focused in on Caucasian males, really these bookend age groups of under 30 and above 60. Alcohol abuse is a really important factor in risk. And then I've bolded here the firearms were used in 65 to 80% of the suicides, and that few of the suicide decedents used VA services prior to their death. So these are opportunities for outreach, education, and training as part of both the Richmond Journey as well as the Governor's Challenge. Next slide. And then you really have to look at, you heard the Arizona team talk about it, and now the Richmond team and broader Governor's Challenge team, the different resources have to be talking, and they have to understand how to refer into the other. So our federal partners in our medical center, our vet center, how are they collaborating with State Department of Veterans Services, who has resource coordinators? How are they collaborating with National Guard Family Program staff? How are all these resources merged together? And so one of the initial focuses was to create a key resource list that all members of the Mayor's Challenge team could then, put those descriptors for the different resources to improve connectivity on all of their resource sections of their websites. And then an example of outreach and education that can happen once you have that core resource product, we looked at the Central Virginia communities, so that would be Richmond City for the Mayor's Challenge team and surrounding counties, hosted their annual suicide prevention conference, and it was SMVF focused for the first time. So they were able to really push out that resource education. And then the city of Richmond hired a veteran outreach coordinator as a result of these efforts, and they're able to focus internal on workforce support to those who identify as SMVF, as well as external in the broader city efforts. So that was a really neat success for resource coordination and ongoing outreach and education. Next step. Okay, next slide. And then I talked about the community providers have to know how to refer into treatment. So the team spent a lot of time working on a referral flow chart for behavioral health and crisis referrals from community providers to VA, to the VA Medical Center in Richmond and back. And this flow chart, as any good referral matrix, is living and breathing and changing. But this Richmond flow chart was used as a model for other VA Medical Center and community teams that are building up around the state as a result of Governor's Challenge expansion. That referral matrix gives you a common language for making sure that there's access to care into the federal system for those that it's accessible to. Next slide. And we also we developed resource cards for emergency responders. This initially came out for the Richmond Police. They wanted something about the size of a business card that could be handed when they were out in the field on calls, and they knew that if resources weren't deployed to that individual or family, that they would be back for intervention. So they were able to, it starts with identifying service members, veterans, and families on the call, and that was a part of the Ask the Question campaign and broader efforts. So once they identified that they're military or veteran connected, they could give the resource card, and it was a really easy brief. The Military and Veteran Crisis Line on one side, so when in crisis, and our Department of Veteran Services Resource Coordination and Peer and Family Support Program called Virginia Veteran and Family Support on the other. So when in crisis this side, everything else this side. So it was an opportunity to equip first responders with really quick and easy deployable resources and increase access to care. Next slide. And then there were the care transitions and recovery support intercept. We really looked at for how to increase the ability for community hospitals when they identify veterans, how to increase access to VA care as well as other resources for SMVF. So our VA Medical Center Suicide Prevention Team and partners on the Mayor's Challenge team created a caring contact letter for veterans discharged from community hospitals. And this has also been used as a model for other medical centers. It's really bridging that follow-on care gap to lower risk post-hospital stay. Next slide. So now I've talked a lot about how that focus of going statewide was there from the beginning, but I'll talk a little bit about our journey up to this point since December. We, as a Governor's Challenge team, there's a lot of cross-membership between the Mayor's Challenge and the Governor's Challenge team, but of course we expanded it to other agencies. And in our pre-site visit for the Policy Academy, which is where we really emerged with a strategic action plan that we continue to build on today, we focused on key suicide prevention messaging, because when you take something statewide, you need that catchy message that people can buy into and we can replicate across the state. So it's care, connect, communicate, and I'll dive into these a little bit more. The other thing I'll say about team formation is that it's cross-secretariat led at the state level. So in state government, we're organized under secretaries. And so under our Secretary of Veterans and Defense Affairs, Carlos Hopkins, who you saw in that Mayor's Challenge picture earlier, it's the National Guard and the State Department of Veterans Services. On the Health and Human Resource side, you have all of the critical human resources agencies such as my own Department of Behavioral Health and Developmental Services, Department of Health, Department of Social Services, et cetera. So you have that, again, that bridge between SMVF specific and mainstream resources at the state level. Slide. So in our site visit, which was early April, we were able to dive deeper and continue pulling action strategies into the 3 C's. So to define it for you all, CARE focuses on provision of accessible and culturally competent care in community settings. Connection focuses on bringing services together from mainstream and SMVF specific, making sure that wherever they seek support, wherever SMVF seeks support, that they find the connection they need. And then communicating to providers about military culture and what resources are available, and to those that we seek to serve as well. Next slide. So in the site visit, we pulled in, we really honed in on 3 strategies under each of the 3 C's. And it's listed here, and I'll do a deeper dive here in the final seconds of our time. Next slide. So under identifying and supporting SMVF at risk, so it's ask the question, consistent identification of SMVF at community intakes, which would be, have you or a family member ever served? And then collecting that data through our data subgroup, and looking at defining a standard for suicide risk screening in community settings. So really focus on screening, safety planning, and follow-up. And who's going to screen, what's that going to look like, and really just enhance access to care. And on the left side of the slide is the CDC strategy that aligns under and the best practices for those approaches. Next slide. Under Connect, it's really increasing engagement between VA, Department of Veterans Services, and the myriad community and state-level organizations. And so we've stood up VA Medical Center and community work groups modeled after the Mayor's Challenge Richmond VA and community team. And we have that now in 2 additional medical centers within the state, and we're hopeful to develop it in Northern Virginia as well as with the other 3 medical centers that serve Virginia veterans outside of our borders. So really looking at sustainability through VA Medical Center and community-based and community work groups in different parts of the state. And we're going to deploy regional military culture and suicide prevention summits, where we provide introductory military culture in partnership with our Department of Veterans Services, pull in lethal means safety training from our VA suicide prevention coordinators, and then we highlight regional resources. Thomas mentioned in Arizona utilizing the Clay Hunt program. We also have a Clay Hunt program in our Hampton VA system, and so that would be one of the regional resources highlighted in that area of the state to boost connections. Next slide. And then in Communicate, really we're honing in on expanding lethal means safety training to community stakeholders, leveraging suicide prevention coordinators within the VAs, and advertising the training and resources available to community partners through that, through the suicide prevention teams, as well as deploying the summits that I referenced. We'll have a heavy emphasis on lethal means safety because you saw in the data, particularly firearm safety is going to be very important when working with someone in an intervention. So it's equipping community behavioral health and support providers with those tools for their toolboxes. Next slide. And this is just a picture of one way to bridge mainstream firearm safety initiatives in Virginia called Lock and Talk Virginia, and military and veteran specific, which would be a partnership which Virginia is a pilot state for the National Shooting Sports Foundation and the American Foundation for Suicide Prevention. That's just another way to enhance what our communities are already doing around firearm safety and bringing in an SMVF specific message. And I believe that's it. Next slide.
All right, thank you so much, Brandy. That's really great information. We have about 10 minutes or so to do some Q&A, and I have a couple of questions for you, and then I have a couple of questions I'd like to open up to both you and Nicola and Thomas. So the first one, Brandy, is how did you ensure your crisis mapping work was tied in with your Mayor's Challenge work in Richmond?
Absolutely. So it was a formal TA process through the SMVF TA Center that hosts this webinar and our broader Mayor's Challenge efforts. So that was a formal invite from the TA Center to participate in that process. But even if communities aren't able to secure a more formal TA process, again, the core tenets of the intercepts and what can be gleaned from that crisis services inventory and mapping innovations and gaps within the crisis services spectrum can be used by any community.
Great, thanks. And the next question I had for you, you talked about a caring contacts letter that your team worked on and formalized. Is that letter personalized?
It can be. It's designed, the VA Medical Center creator, who I believe is also on the line. She and team members made it so that it could be both. It says, "Dear Veteran," but if you had a hospital partner, it could also be editable to be personalized, which definitely would have a more intimate feel for sure.
Mm-hmm. All right. So this is a question for all of the presenters. Both of your presentations shared a number of communications that you've done through either Be Connected or through your, Brandy, your strategy on Care, Connect, and Communicate. And so some of the participants are wondering if you had a communications plan that you are able to share.
So this is Nicola. Not so much as it's like a formalized plan in a shareable format. I will say we have a plan of what we're doing. It's not necessarily documented in a kind of one place in terms of how we do it. I can talk a little bit about our overall strategy with Be Connected. One of the things you'll notice is that you really don't see much of the word suicide, crisis, or anything like that, along with, our efforts to have that more upstream intervention. We really try to keep it very much focused on support, connection to resources, and in general just a positive message about, there is support for everyone who needs it available. So so we definitely have an intensive focus on that, and that actually is a big focus of this coming year for us as we look to propagate Be Connected in communities around the state. It becomes ever more increasingly important, obviously, that our messaging is customized and adapted to do that. And also as we onboard our partner organizations and communities, there's a whole messaging component that goes along with that. So I guess the answer is a little bit yes and a little bit no.
Great. Thank you so much, Nicola. Brenda, did you have anything you wanted to add there?
Absolutely. So yes and no. So I'll talk through that. I would encourage teams to leverage individual agencies, especially now that we've pulled the work up to the state level. You're dealing with a lot of state agency partners that have very established communication plans driven by their mission. So in the team work, it's working through what are the components of that we could add SMVF-specific messaging to. And the strategy that the Virginia team is taking is to integrate the key team product. So what are the resources? Like I said, in the Richmond team, they had that key resource list that'll be expanded for the state level work. But what are the key resources such as military culture training, suicide prevention trainings, lethal means safety training? Those key educational products that we want pushed out widely. And in the team plan, we will come up with ways to push that out widely using all of our networks. So one of the action items is to inventory key conferences and gatherings that we can push out those products. So ours is, at this stage at the team level, educational product driven, and how are we going to develop communication strategies around pushing those out statewide. And then one of the key strategies that we saw at the Mayor's Challenge level is really putting those key SMVF resources that have embedded and that the team wanted to promote widely, such as Military One Source, dropping those on everybody's agency website so that wherever someone landed looking for support, they would find key connection portals. So in process is my answer. That was really, really wordy.
Thanks, Brandy. So I'm going to take one more question and then we'll close. And I'll do a little bit of housekeeping at the end too. But this last question centers around families, and it's a bundle of a number of questions. So all of your programs are great and emphasize an integrated approach. So this particular one is asking, a problem that we've seen in Texas is even with well-informed caregivers and advocates, the mental health facilities do not welcome family in the workup for people in crisis, and screening is done in some primary care, but they do not react to the screen unless a plan is indicated or violence to others. You get the idea. This is a troubling thing. How does Arizona and Virginia handle the issues of family, and what have you done to try to overcome those issues? Brandy, do you want to go first?
Sure. So we had to create a workspace that we could pull the family focus under. So when we were looking at work group strategy, we have peer services, military culture, and behavioral health resources, and a third component of the family member and caregiver subcommittee. So that's where we will be inventorying all resources and programs that we want to align with this work that are military and veteran family centric. The TA process has educated us on a lot of those, such as the Veterans Health Administration Caregiver Support Program, Coaching into Care, and we're able to drop those into our educational products for outreach and education and broader resource education. And I think this is a really great way to partner with your nonprofit sector, who can get very creative in how they want to serve, how they can serve military and veteran families. We're looking at ways to really capture the nonprofit sector on the family front. And we're also really fortunate that our State Department of Veterans Services and National Guard both have very robust family services systems. So we're able to lean on the state system quite a bit and just educate citizens on what's available through important entities like National Guard and Department of Veterans Services. But in the absence of that formal structure, as Thomas said, look to your left and right and survey providers who are doing family services. And even if it's not SMVF specific, what military culture training could be provided to bolster their ability to outreach and serve this population.
Yeah, and just to piggyback on that, I think, Brandy, I think everything, all those different resources you mentioned are important, that there are kind of pieces there embedded in our systems to encourage and support those family members. But I think, one of the most important things is kind of swinging that door open wide enough that it's clear that we're not focused only on the service member and veteran, and that we very clearly communicate in all ways, at all times, that we understand this is an impact on the family, and that the family member, sometimes they're seeking help for their loved one, and sometimes they need help and support just for themselves. And ensuring that that message is consistently delivered, that we are here for you also. These resources and support are here for you, and ensuring that that message comes across loud and clear, because we can't organize our system in a way that we'll never have those incidents that were described. But if family members know, hey, there's somewhere you can turn to for help, that will go a long way to ensuring that they just don't accept a negative situation like that and they get the support that they need.
And I think a good example of that is really simply and quickly, in our Navigator trainings, we will have people consistently who will sit through most of the training and then at the very end go, hey, you know what, my father or my mother was in Vietnam or Korea or whatever, and have struggled, and now I'm just realizing that we've had this, but I've been working in this field for a long time, so it's great to be able to know this information now, and it starts to put in context for people just how pervasive and even intergenerational the issues are.
Thank you so much. So thank you to Nicola and Thomas and Brandy for these great presentations. It's been such wonderful information and very helpful, I hope, to all of the Governor's and Mayor's Challenge teams that are out there working on their action plans, as well as others who joined in and listened that are working to better support their service members, veterans, and their families and their communities. I want to let everyone know that as we close, we will be sending out an archive link to those who have registered for this event, so you'll have an archive of this that you can watch and share and listen to, and also a copy of the slides. And if you have any questions or want to get in contact with the presenters, please do not hesitate to reach out to SAMHSA's SMVF TA Center. We're here to serve you. Thank you. Goodbye.